As more children were cared for outside the home at earlier ages, a concern was raised that childcare might interfere with normal developmental processes, such as an infant forming a secure attachment with its mother. In 1991, the NICHD launched the study of early childcare and youth development at 10 research university sites across the country and a data coordinating center. The study followed more than 1,000 children from the time they were 1 month old, investigating the short and long-term relationship between childcare and children's development. Study investigators examined how differences among families, children, and childcare arrangements might be correlated with the intellectual, social, and emotional development as well as the health of children. The children taking part in the study were evaluated periodically, most recently at age 15. Using a variety of measures, the study investigators evaluated the academic achievement of youth taking part in the study. The students also were asked to evaluate their own behaviors. These evaluations include measures of behavioral problems, such as acting out in class, impulsive behaviors, like acting without thinking through the consequences, and risk-taking behaviors, such as behaviors that might harm themselves or others. The study investigators then compared these responses to data collected earlier in the study to determine if there was any association between their childcare experiences before age 5 and their evaluation results at age 15. Teens who were in high-quality childcare settings before age 5 scored higher on measures of academic and cognitive achievement and reported fewer acting out behaviors than peers who were in lower-quality childcare arrangements during their early years. Moreover, teens who logged more hours in childcare in their first 4.5 years of life reported a greater tendency towards impulsiveness and risk-taking behaviors at age 15 than did peers who spent less time in childcare. These patterns were consistent with correlations observed throughout the study history. However, it is important to point out that the differences in these measures among the youth in the study were very small and that the behaviors observed were well within what is considered normal. It is important to keep in mind that the overall finding of this study is that parents have far more influence on their child's growth and development than the type of child care they receive. That said, at age 15, high-quality child care experienced before age 5 appears to provide a small boost to academic performance and reduction in problem behaviors, perhaps by fostering the early acquisition of school readiness skills. Likewise, more time spent in childcare before age 5 may provide a different socialization experience, resulting in slightly more impulsive and risk-taking behaviors in adolescence. These findings underscore the importance of studying the linkages between early care and later development.